I'll tell you what's legendary. Again, I'm just very impressed with our musical director, John DeCoste, because he's the only person in the history of music to ever work the word osteopathic into lyrics.
Right, and rhyming edema on my thigh with pink stuff in my eye.
It's very good.
That's awesome.
Very good. Doc, I know you're impressed.
I'm very impressed, but my impression level is pretty low.
On this show, for sure. All right, now this is the awkward stuff. We have to ask you about Princess Kate. Obviously, you're not looking at her records. You're not her doctor. But basic general medical knowledge, we're looking for some optimism here. Is there any way to tell what sort of case she's dealing with?
No, believe me, there's a lot of speculation going on because this surgery was thought to be routine. It was not thought to be a cancer surgery. So, I mean, I guess, and I hate to speculate, but a female in her 40s, what would, if you ask surgeons, what do you think? Most people would say, well, good chance that it was a gallbladder surgery. Mm-hmm. But it's interesting, what they did is they do the surgery, then they take that tissue and they send it to the pathology department where the pathologists, doctors who have been trained to look for different things, must have found some cancer cells and said, hey, you know what, we have this concern. So that's why she's getting what they're calling preventative chemotherapy. In the medical terms, we call it adjuvant chemotherapy. And sometimes that chemotherapy is given prior to surgery if we know it's a cancer surgery so that it shrinks the tumor, makes it easier for the surgery. And other times it's given post-surgery when cancer has been noted and it says, okay, let's go in and try to get any that may have spread. Let's get in there and try to, clean things up a little.
When I heard her say, my heart goes out to her because I just adore her. And I felt so sorry, Dr. Most, for people who were trolling and saying, there's a great deal of privacy that is earned here and warranted. But that being said, when she came out and said preventative chemotherapy, I hadn't heard of that before. Does that mean that radiation will likely follow or not? Or does it just depend on the illness that she's battling?
Yeah, it totally depends on the illness that she's battling. Depends on the type of cancer and where they found it and how much they found. So it varies from individual to individual. And I can say is I totally agree with you about let's let her privacy there. She's a very strong individual to come out and say this. And I think it just highlights, here she is 42 years old. It's just highlighting that cancer is starting to hit more and more younger people. So hopefully good will come out of this where it'll increase the awareness of what cancer screening do I need to start and when do I need to start it. Sometimes celebrities have bad things happen to them that actually have a ripple effect that is good for the entire world.
Yeah, and that was my other question to you, too. 42-year-old woman, mother of 3. What can young women, young mothers, in that 40-year-old range, what can we be doing? I'm going to put myself in that age range now for a quick second. What can we be doing?
Well, you're not there yet, but you'll
to protect ourselves, including mammograms?
Yeah. So when you look at it, and not just females, but I'm just going to say everybody.
Yeah.
But certainly females look at breast cancer. We used to start doing breast cancer screening at the age of 50. Now, it's down to 40. Mm-hmm. The American College of Obstetrics and Gynecology says, hey, that first mammogram should be done at 40. American Cancer Society says 45, but certainly that's moved down. Look at colon cancer. Used to start at 50. We all know Eddie Olczyk and his story about how he had identified cancer before he was 50. Look what's happened there. That colon screening has gone down to 45. Mm-hmm. And certainly you're reading, tell me about all these total body MRIs, that a lot of celebrities are doing now to look. Is that going to be the future? It could be, but certainly knowing the common breast and colon cancers, know when those screenings are supposed to start, and don't be afraid to go and do them.
Yeah. Absolutely.
We're getting into better weather sooner than later, and a lot of us old jocks still think that we're jocks, and we're going to go out, we're going to pull a muscle, we're going to strain something, we're going to maybe do something worse. When we come back, I'd like you to address that. We're also going to talk about Wegovy and the approval for some Medicare patients, and anything new you may know about these weight loss injections. And, Kelly Clarkson's talking about a gummy that she used to lose weight. And I don't know anything about it. and then measles. We'll hit all of that when we come back. Dr. Kevin Most is with us. Doc, I'm having a blueberry muffin, because you got to get your fruit. And there's just no good way to eat a muffin, Doc. Have you noticed that? So when Brett comes in here later, I just want to know if he's hungry. There's plenty of crumbs on the floor.
A couple of walnuts.
Did you make those blueberry muffins?
Yes, as far as you know, I did. I try to get Doc to invest in a restaurant because nutrition and appropriate nutrition is important. It was called Just Tops. And it would be pizza tops without the crust. It would be muffin tops like the Seinfeld episode. Just chicken skin.
I like that.
That's where I lost him. That's where he zoned out and went, don't talk to me anymore.
What about if you had just vats of cheese?
Just
like you can have, or blue cheese crumbles.
Yeah.
You can just have like a cheese section.
And a spoon.
Exactly. Sorry, Kevin. I don't mean to add fuel to his fire.
This will be Kevin's last appearance.
Yes, really.
Over-the-counter medicine that reduces the duration of the flu that may have expired in January. A texter wants to know if you can still use it. This goes to the bigger question of expiration dates on medicines. What's the general rule?
Yeah, something that expired in January, it is still totally safe to use. Go right ahead and use it. If you tested positive for influenza, the Tamiflu will shorten that duration. It's not going to make it go away right away, but it'll shorten that duration, and it should still be fine. As far as potency for medications, I have to put a date on them, but I can tell you that most of them, most medications are still good for, I'd say months after that. I wouldn't stretch it to years, but certainly I wouldn't throw away medication that is 2 months, 3 months, 4 months past the expiration date. If you pick it up and it's like expired in 2019, might be a good time to replace that.
I was going to say no Robitussin from like 2017.
My Flintstone
Pepto.
Vitamins from 78, no good anymore.
No.
Yeah, you got to toss them eventually.
Those are good.
Athletes, old athletes, not that I know any, who want to jump out when the weather's good and suddenly they're going to go for a run, or suddenly they're going to play full court basketball, or suddenly they're going to
play a
get
round of
back
golf.
into baseball. Whatever the case may be. Stretching's obviously important, but any other advice?
No, but I mean, you do make a good point, and you heard AD come in there very subtly and say, and play a round of golf. People who have not hit golf balls, have not done anything, and now are going to rush out to play and expect to play great. Just because it's April 1st does not mean you can touch your toes.
Right.
You need to really start slow, listen to your body. So really, stretching is probably one of the most important things that seniors can do right now. Stretching and balance are so important, and people don't understand that. And then really mix it up. If you're going to exercise, don't just say, I'm going to run every day. Well, no, don't run every day. You might run one day, lift some light weights someday, do some different cardio, do some stretching. So really kind of change it up. And then really try to focus on a consistent plan of exercise and stretching. Don't have to have a perfection. Don't have to say, I'm going to work on this 5K until I can do it under X number of minutes. No. Think about why you're doing this. You're doing it for your cardiovascular health and your mental health. So really do things that you enjoy and try to do as many of them outside as you possibly can.
What's the appropriate amount of days a week to work out, Dr. Most? Do you do a hard workout, say on a Monday, rest on a Tuesday, or can you do 5-6 days, but like light workouts each day?
You can do 5-6 days light workouts, but certainly don't rush into doing a heavy workout right now. We always look at what's the cardiovascular benefit. We know that if you do 30 minutes a day for 3 to 5 days a week, that's great. And cardiovascular meaning, get your heart rate up to an appropriate level, depending on your age. So really, 100, 110, 120 heart rate. And then try to keep it there for 30 minutes, which you can do with a brisk walk. You can do riding a bike. You can do doing an elliptical. So that's from the cardiovascular point of view, but I can't tell you. I know myself, stretching is probably the biggest thing that we can work on right now. And Steve, I know you try to your goal is to touch your knees. Other people, their goal is to really to touch their toes. So do that slowly.
I actually, Jimmy Kimmel has Guillermo. I actually hired a guy to touch my toes for me.
There you go.
Yeah.
It's not Tom.
It's a toe-touching service.
Hey, Dr. Most, we've talked in the past with you about various weight loss drugs, Ozempic, Wegovy, and we know that most insurance companies don't cover the weight loss drugs for weight loss. Of course, for diabetes they do. But last week, Medicare did approve the use of Wegovy for patients who have a risk for recurring heart attacks or strokes.
Yeah, so this is going to be big because two things. One, the comment that you made is important for people to understand is that a lot of insurance companies are going to stop from trying to pay for this medication, even though it's for the health of their constituents. But I would still sit there and say, okay, what's going to happen now? Medicare is kind of a pilot for us. A lot of companies, once Medicare approves something, a lot of the insurance companies are going to fall into in tow and follow right behind it. So that's great. The good thing is that we're really starting to look at Wegovy as more than just a weight loss drug. So like you said, Medicare, this was big news last week for Medicare. The study that came out that we talked about just a couple of weeks ago that showed this 20% impact on cardiovascular health is now Medicare is taking it seriously and said, you know what, we're going to approve it. For individuals who we are concerned about having recurrent heart attacks or strokes, we are going to approve Wegovy. That's going to open it up for others under regular insurance, but it's really, I think, showing the impact of this medication not only on, diabetes, weight loss, heart protection. I mean, it's a blockbuster drug that is now just expanded in opportunities to be used.
Measles, any updates there?
Yeah, a couple new cases here. I think the sad thing about measles is when we look at this, we're already surpassed the number of cases in 2023, and it's not even April yet. So, now we're 64 cases across the United States, 17 different states. So really, people really need to be aware, especially if they have children, get their vaccinations done. We have some schools across the country that have low vaccination rates in the teens for kids entering kindergarten, which is just a disaster. So, new case in Will County, new case in Lake County. We are going to see more of this. Get the vaccine done. It's a very effective vaccine, 2 doses, one at the age of 12 months, and then one before going into kindergarten. And if you look, the vast majority of these cases are individuals who were under the age of 5.
And let's circle back for this last one. 847 texter. What do you recommend to work on balance? Just a couple different things.
Yeah, it's really good. Working on balance is so important. So can you stand on one leg, and how long can you stand on one leg? That's extremely simple to do. Switch legs. Can you bend to a certain point and lift a leg? And you're saying, Kevin, what you're talking about is yoga. And I'm like, it certainly is, because 2 things happen there. 1, it works on your balance, and 2, it works on your core muscles. So yoga is great. So really it comes down to, like we know, our balance is made up of a couple things. 1, receptors in our ears that tell our brain kind of what our body position is in. Our vision is telling our body that, and then our feet. So those 3 things, and that's why if one of them goes haywire off in the ear, we get what we call vertigo, where our balance is off. So really what you want to work on is the ones that you can work on. You're not, keeping your vision healthy, certainly, but really it's going to be those receptors on the soles of your feet in your core body muscles to make sure that you can keep your balance.
One last question here. The textures are great today. And let's see, this is a 847. I can't have the shots. Any news on oral vaccinations?
Not yet, but nasal vaccinations, the nasal spray will certainly be, hopefully they're getting nasal flu shots right now. They're using the nasal spray. It certainly looks like COVID will have one of those as well. But as far as oral, the bad thing is that once we take it, it gets in our stomach. The high acid content in our stomach breaks down all of those. So it's going to be extremely difficult for that to occur. The reason it works so well in the nose is we have a high vascular. Anybody who's had a bloody nose in the past knows how vascular the nose is and that it's absorbed quickly and can work. So look for a nasal vaccine for COVID, but certainly use a nasal vaccine for influenza. As far as all the others, there's not a lot of work for like a nasal measles vaccine for kids. We're still going to continue to give shots for that.
This show will always be about highlighting experts, and your expertise is appreciated, my friend. Thank you as always.
You got it, guys. Take care. We'll talk soon.
See you, Kevin.
Dr. Kevin Most.
He's going to play golf in a warm climate.
He's in a good position now where he goes back and he's got places in North Carolina. Mm-hmm. So you can go back and forth, go to Pinehurst, things like that. But he's still doing medicine every day.